Hello and welcome back to my channel. Today we're discussing a topic that affects millions of people worldwide, lung cancer. If you or a loved one has been diagnosed with lung cancer, or if you're looking for more information about how doctors diagnose and manage this condition, this video is for you. Lung cancer is a serious disease, but advances in medical research have led to better diagnostic tools and more effective treatments than ever before. In this video, we'll go over how lung cancer is diagnosed, the tests involved, and what treatment options are available based on the stage and type of lung cancer. We'll also cover the latest advancements in lung cancer management, including targeted therapies and immunotherapy. By the end of this video, you'll have a clearer understanding of what to expect and how lung cancer can be treated. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Lung cancer often doesn't cause symptoms in its early stages, which is why many cases are diagnosed at a later stage. However, when symptoms do appear, they may include a persistent cough, chest pain, shortness of breath, unexplained weight loss, and coughing up blood. If you experience any of these symptoms, it's important to see a doctor for further evaluation. The first step in diagnosing lung cancer usually involves a thorough medical history and physical examination. Your doctor will ask about your symptoms, smoking history, exposure to environmental risk factors, and any family history of lung cancer. If lung cancer is suspected, further testing is required to confirm the diagnosis. A chest X-ray is often the first imaging test performed. It can reveal abnormalities such as masses or nodules in the lungs, but it cannot determine whether a mass is cancerous. If anything suspicious is seen, additional imaging tests are needed. A CT scan, or computed tomography, is a more detailed imaging test that provides cross-sectional images of the lungs. It helps doctors see the size, shape, and location of any lung abnormalities and whether the cancer has spread to nearby lymph nodes or other organs. If a suspicious lung nodule or mass is detected, a biopsy is needed to confirm whether it is cancerous. A biopsy involves removing a small sample of lung tissue, which is then examined under a microscope by a pathologist. There are several ways to obtain a lung biopsy. A bronchoscopy is a procedure in which a thin, flexible tube with a camera is inserted through the mouth or nose into the lungs to collect a tissue sample. In some cases, a needle biopsy is performed by inserting a needle through the chest wall to obtain a sample from the lung tumor, often guided by CT or ultrasound imaging. In certain situations, a small surgical procedure may be required to remove a larger tissue sample for diagnosis. Once lung cancer is confirmed, additional tests are done to determine the type of lung cancer. The two main types are non-small cell lung cancer, which is the most common type and accounts for about 85% of cases, and small cell lung cancer, which is more aggressive and tends to spread quickly to other parts of the body. After identifying the type of lung cancer, the next step is staging, which determines how advanced the cancer is. Staging helps guide treatment decisions and involves additional imaging tests such as PET scans to detect cancer spread to the other parts of the body, MRI scans to check if the cancer has spread to the brain, and bone scans to detect cancer in the bones. Lung cancer is staged from stage 1 to stage 4, with stage 1 being localized cancer and stage 4 indicating that the cancer has spread to distant organs. Once the stage is determined, a treatment plan is developed based on the cancer type, stage, and overall health of the patient. The treatment of lung cancer depends on several factors, including the type, stage, and the patient's overall health. There are multiple treatment options available, and in many cases, a combination of treatments is used. For early-stage non-small cell lung cancer, surgery is often the preferred treatment. The goal of surgery is to remove the cancer before it has a chance to spread. Depending on the size and location of the tumor, different surgical procedures may be performed. A lobectomy involves the removal of an entire lobe of the lung. A pneumonectomy is the removal of an entire lung, typically done when the tumor is large or centrally located. In some cases, a segmentectomy or wedge resection may be performed, which involves removing a smaller portion of the lung, often for patients who may not tolerate more extensive surgery. For patients who are not candidates for surgery, radiation therapy may be used as an alternative. Radiation therapy uses high-energy rays to kill cancer cells and shrink tumors. It is often used for patients who cannot undergo surgery due to other health conditions. For advanced or metastatic non-small cell lung cancer, chemotherapy is a standard treatment. Chemotherapy involves the use of drugs that kill rapidly dividing cancer cells. It is often combined with other treatments such as radiation therapy to improve effectiveness. In recent years, targeted therapy has revolutionized the treatment of lung cancer, particularly for patients with specific genetic mutations. Targeted therapy drugs work by blocking the growth of cancer cells with mutations in genes such as EGFR, ALK, and ROS1. These treatments are often taken as oral medications and tend to have fewer side effects compared to traditional chemotherapy. Another breakthrough in lung cancer treatment is immunotherapy, which helps the body's immune system recognize and attack cancer cells. Immunotherapy drugs such as checkpoint inhibitors have been shown to significantly improve survival rates in patients with advanced lung cancer. These treatments work by blocking proteins that prevent immune cells from attacking cancer cells, allowing the immune system to fight the disease more effectively. For small cell lung cancer, treatment usually involves chemotherapy and radiation therapy. Because small cell lung cancer tends to spread quickly, surgery is rarely an option. However, recent advancements in immunotherapy have also shown promise in improving outcomes for patients with this type. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, lung cancer treatment can be challenging, and patients may experience side effects from surgery, chemotherapy, radiation, or targeted therapies. Palliative care focuses on improving quality of life for patients by managing symptoms such as pain, shortness of breath, fatigue, and emotional distress. Palliative care can be provided alongside curative treatments and includes supportive measures such as medications to relieve pain and discomfort, oxygen therapy for breathing difficulties, nutritional support to help maintain strength, and psychological and emotional support for patients and families. Support groups and counseling can also be valuable resources for individuals coping with lung cancer diagnosis. Many patients find comfort in connecting with others who are going through similar experiences. Medical research continues to advance, and new treatment options are being developed to improve outcomes for lung cancer patients. Clinical trials are exploring novel therapies, including combination treatments that use immunotherapy with chemotherapy or targeted drugs. Advancements in liquid biopsies, which detect cancer DNA in the bloodstream, may improve early detection and help personalize treatment plans based on a patient's unique genetic profile. With ongoing research, the outlook for lung cancer patients continues to improve. While lung cancer remains a serious disease, early diagnosis and the latest treatment advancements offer hope for better survival rates and quality of life. Lung cancer is a complex disease, but with early detection and the right treatment approach, many patients can achieve better outcomes. If you or a loved one has been diagnosed with lung cancer, it's important to work closely with your healthcare team to determine the best treatment plan. Thank you for watching. As always, take care of yourself and make the most of your day.